This is small lab animal training on daily care of mice. The objectives for the trainee involve a self-assessment. To be successful in record keeping, you'll need to complete your task sheets daily. Your records need to be accurate. You need to be submitting your daily data entry accurately. And you need to have successful identification of and self-correction of any errors. To be successful in husbandry means being nearly perfect when it comes to several tasks. This is where you have one error with no fatalities. Water bottle distribution, identification of water bottles needing replacement, correct performance of cage changes, identification and recording of new births, and successful identification and self-correction of errors. Success in equipment operation looks like your indicator tape duties being completed daily, maintaining accurate records, and safe handling of the equipment. Success in sanitization looks like adhering to the posted schedule, forward thinking for items that might be needed for future months, and accuracy in equipment cleaning as well as its distribution. Accuracy for daily care tasks is scored and calculated during the first 90 days of employment. This is based on a 0 to 5 rubric. The lower the number, the fewer errors. Experienced staff will assist during the first 2 weeks. Learners will be provided immediate feedback. There is an assessment and evaluation rubric that breaks out each task that an LAT1 is expected to perform, along with your potential score for each item. Some of these duties include equipment operation, sanitization skills, and other skills such as receiving new animals and data entry. This is a map that shows the facility with each researcher's housing highlighted. This gives you an idea of where our animals are and what rooms are currently off project. Things that you'll need. Every day when you're going into the facility, you are expected to collect items that you're going to utilize during that shift. You will need a blue or black ink pen, a dark colored transparency pen, a recycled cage card or other small paper for notes, possibly a walkie-talkie, and then you will need laminated checklists. You're going to need the animal area checklist, a birth record checklist, a health concern, laminated card, and you very well might benefit from taking the Every Room, Every Day laminated sheet.
Before you leave the office, you need to go look at the schedule, as it changes every day. Make sure that you grab yourself a wet erase pen, a blue or black pen, and an extra fine Sharpie. The schedule is going to tell you what rooms you're responsible for, as well as any extra tasks that have been assigned your way. Write those down on a note card. You're also going to want to check your email, reply to anything sensitive, and before you leave the office, look at the census sheet. Here we're looking at the census sheet to see what's happened with the rats in 0136. You can see that there was a new line added, and that was just the day before, so there's 2 additional cages in there. You want to make sure that you know that for your census report on the door. This is for 0125. We have a cage of mice in there. We just want to see how many. 1 cage, nothing has changed in there. Now that you have that information, you can start your day.
What you'll be doing every day includes health checks, providing soak chow, providing treatments, counting pups, observing cages, observing equipment in the rooms, performing the census, stocking or restocking supplies, stocking or restocking PPE, and completing the room task sheet. This is a list of common abbreviations. You may see these on cage cards. You may see these on the room schedules. If you are not familiar with these common abbreviations, please make a note of them, as they are normal parts of our vernacular. Health checks. Health checks involve assessing body condition, making observations, understanding common abnormalities, and understanding case management. When it comes to health checks, SOP SLA 001, Daily Health Observation for Small Laboratory Animals, states that, quote, visual observations are made of each small laboratory animal every morning, unquote. Emergency concerns should be directly communicated to the SLA veterinarian and research staff via a phone call. Healthy animals should not be so skinny as to have skeletal structure of the hips and the ribs prominent. Normal animals have or are a glossy coat, clear eyes, normal posture, they are active, and they have use of all limbs. Animals of abnormal health may have one or more of the following issues: a poor body condition with easily observed skeletal structures such as the hips or ribs, a poor coat condition, this could come across as ruffled or unkempt, ocular discharge, a hunched posture, and possibly injuries. This visual is a body condition scoring scale where we can score animals from 1 through 5. A mouse with a body condition of 1 is emaciated. This is a very unwell animal that needs to be euthanized immediately. Body conditions 2 or 3 might benefit from supportive care. They might need to be euthanized. This is one where if the research can be obtained, now that the animal's at this point, we would want that animal euthanized. Body condition 3 is more optimal. They are well conditioned. We're not going to see vertebrae and the dorsal pelvis. A body condition 4 is an animal that's a little chunkier, a little overconditioned. And an animal with body condition 5 is obese. This might be appropriate if this animal is on a high-fat diet, or this might be an animal that perhaps needs to be evaluated for an underlying problem, period. When it comes to health checks and assessing body conditions, please consult the small lab animal veterinarian if you have any questions. The body condition scoring is a very useful tool for evaluating the overall condition of the mouse. Body condition scoring is very helpful in cases where you're dealing with pregnancy, organomegaly or large organs internally, or tumor growth, particularly intra-abdominal growth tumors, as those can all interfere with body weight assessment. Using the body condition scoring does not mean that these animals then would be exempt for other criteria for an early euthanasia. For instance, if an animal has a good body condition score, but they have a hunched posture, a ruffled hair coat, they're reluctant to move, or their tumor diameter measurements are outside the standards, those animals may still need to be euthanized. Body condition scoring is very easy to perform. Often you can do this cage side, but if you are having the animal in hand, you can restrain the animal on the top of the wire top and then pet the animal over the spine to see how prominent the vertebrae are. Facial grimace scale is another very useful tool for assessing rodents. In this case, it's for assessing pain. This scale does take training to use, as the observers need to be consistent in their reporting. With facial grimace scale, you're looking at orbital tightening, nose bulging, cheek bulging, ear position, and whisker changes. You're hoping for zeros for all of those scores where it is not present. You may see a score of 1 where it's moderately present, or scores of 2 where it's obviously present. And those scores may shift along the 5 different requirements. When you're performing your health checks, you want to observe that cage without handling the animals. You want to note their behavior, their posture, their coat condition. You want to evaluate for any abnormalities such as wounds or lesions, any limb irregularities such as not weight bearing, any tooth irregularities such as overgrowth, any masses, or any prolapses, either vaginal or rectal. To fully develop your skills in identifying health abnormalities, you're going to want to refer to the following PowerPoints: the Animal Health Photo Library, as well as the Clinical SLA. This video demonstrates health checks for 4 healthy cages and 1 with mildly dehydrated and lethargic animals. It also shows the treatment of those animals with heat and soaked chow. Please note, normal health checks don't require the removal of the cage for assessment. You should be able to see the mice through the sidewalls without taking the cage from the rack. Also note, this video was taken prior to the research showing how tunnel handling reduces stress. We did not have tunnels in the cages at the time this video was created. See the coat difference? These 2 animals are a little bit quieter. Their coat needs a little bit of tending. They're huddled, and they're a bit reluctant to move. Bringing them to the hood allows us to get a better visual of the animals. The technician's doing a pinch test to see if the animals are dehydrated. That slow skin turgor is an indicator of a dehydrated animal. This video was also taken prior to the facial grimace scale being developed. So there's no assessment of these animals for things like nose bulges or squinting. These animals are going to benefit from a treatment of soaked chow, their own food taken from their food hopper, with water from their own water bottle added to it so that it makes a softer food. A lot of times animals that aren't feeling well struggle to hydrate properly, Giving them soap chow gives them an added opportunity for water. The technician's now preparing a heating pad. Heating pads can be used in situations where a cage needs to be given a heat source. Half of the cage is on the heating pad, half is left off of the pad. That is appropriate for the animals to be able to self-select if they want warmth or not. Which of the animals in this image is the healthy animal? Of the two, you have one who has a more normal body position. The second is a bit abnormal. That animal is hunched. Does that catch your eye? That is what you'll be seeing and looking for in animal cages. Do you see the abnormalities in this animal's mouth? This is with their teeth. This is a condition called malocclusion. It's when the jaws don't align properly, so there is overgrowth of the upper and or lower incisors. If you see a mouse that has poor weight, poor body condition, please check their teeth for overgrowth, as that's often the first sign. Case management. To open a case, you're going to be recording your findings on an orange health card and in the DOS, or Daily Observations sheet. On both, you'll be describing the condition, the symptoms, the part of the body affected. You need to use at least 3 objective clinical measures, such as weight loss, tremors, swelling, bleeding, body condition score, trauma score, facial grimace score. Describe what needs to be done or what is being done to treat the condition. Make note of the cage card information, and then if you are asking for a veterinary evaluation, flag the cage with a vet health check card. Here you can see the upper image has the veterinary health check card. The lower image has the orange card with the animal's case report. Those orange cards stay with the animal cage for the lifetime of the last animal in the cage. Orange cards on the front of the cage card holder indicate animals that are currently under case management. Reporting your cases, you'll need to provide the following information to the researchers and the veterinary staff: the room, rack, and cage location, the researcher and PI name, the IACUC or Center Project number, the strain of the animal, their sex, and the most relevant data of either date of birth, date of weaning, or date of arrival. If the animals have any identification on their bodies or on the card, please record that. Also record any stickers on the card, any PI comments or numbers, and any litters in the cage and their date of birth. We have developed a template that helps you email this information, and we ask for all of this information on the laminated card that we provide you that you should be taking with you the first few months that you're working on cases. Your next steps for case management. The first option, you might be able to start a pre-approved medication or treatment. Should that happen, you're going to need to fill out an RX tag and place it on the cage card holder, and fill out an RX sheet and place that on the clipboard. Your second option, you can contact lab members with recommendations for treatment. There is a spreadsheet that tells you all of the researchers' contact information. That is in our rodent records folder on the X drive. Your third option is requesting a veterinary evaluation. To do that, you'll need to be sure to place that veterinary health check card on the cage card holder. Regardless of the activity that you choose to take, you have to record any open cases in the daily observations spreadsheet, and that is located on our SharePoint site. Deceased animals. For general conventional animals, if you find a mortality, there are specific steps that you need to take. First, you need to record the information on the cage card. You'll need to record the number of deaths, the date, and then update the cage population number. Handling these animals, you'll place the carcass in a morgue bag or a Ziploc bag. If the body is needed, you will label that bag with the researcher's name and place it in the secondary container in the refrigerator. If the body is not needed, the body can be placed in the freezer outside of room 0118. If you're not sure if the body is needed or not, assume that it is needed or ask teammates. Communication. Email the research staff alerting them to the mortality and then record the information in the mortality log. If this fatality involves anything other than a rat or a mouse, reach out to the Small Lab Animal veterinarian immediately. Deceased animals in the ABSL2 or ABSL3. In 0123 and 0134, the ABSL2 rooms, there is no freezer in that room. You will double bag the body and then transport it to the freezer adjacent to room 0118. For the 0125 ABSL3, there is a freezer in the room. You will place the carcass in a single zip top bag, and the carcasses will be autoclaved as the freezer warrants. Soaked chow. Look for the sea green tags on the cage card holders. Soaked chow is generally speaking for weanlings or medically fragile animals. To provide soaked chow, you're going to place 2 to 4 pieces of their feed from their feed hopper in an empty soaked feed cup, which is a petri dish. You're going to place that in the bottom of the cage, add water from their water bottle, coating the feed as you fill the container. If they don't have a dedicated water bottle, there may be one that has been specified in the hood for soaked chow development. Replace the cup if leftovers remain. Clean and reuse the cup if it's empty. And be sure to take care to store the water away from disinfectants. Treatments. Cages marked for meds need medication. So if it says RX, there needs to be a treatment conducted. Check the clipboard for an RX sheet. The RX sheet will have those specifics. Most of our medications are topical or injectable. Injectable routes generally are sub-Q or IP. Please communicate with your teammates or your manager if you have a medication that you can't administer, and be sure that if you did administer the medication, that you have signed off for that treatment. Breeder colonies. For new litters. Each breeder cage must be assessed daily for new pups. Breeder cages are the cages with yellow breeder cards. To look for pups without opening the cage, look on the sides of the cage and underneath the cage. This is an instance where you can remove the cage from the rack very, very carefully. New pups are going to be tiny, the size of a jelly bean, and very pink in color. Count their tails. It can be a hard time getting an accurate count, as the pups generally like to lay on top of each other. Record the count on the yellow cage card. You will then need to record the IACUC, strain, and the count on a piece of notepaper in order to document it in the birth log on our SharePoint site. Ask a SLA member if any researchers require additional information. Some helpful tips for breeding colonies. We typically flag cages close to parturition with a pregnant sticker. This is not 100% though, so you still need to check every cage. Another tip, check for past delivery dates. Mice have a 21-day gestation. If several months have passed since the last litter, pregnancies are less likely. The litter that you're seeing today may have been born and recorded yesterday. Flagging cages. New mouse litters are to have their cage changes delayed for 3 days postpartum. Only flag the cage if the room is due for a change inside that 3-day window. So, for example, cages are due for changing on Sunday and the litter was born on Wednesday. Is that one where you have to flag or not? No need to flag that cage. What about this example? Cages are due for changing on Sunday and this litter was born Friday. Would you flag that cage? Yes, you would. This is what those flags look like. New pups don't change cage until whatever the date is that's appropriate. Breeding colonies, weaning. For more information, you're going to want to look at the SLA Guideline 002, Maintenance of Rodent Breeding Colonies, and the PowerPoint training for breeding colony maintenance. For mice, generally speaking, we wean at 21 days, unless IACUC approval has been granted to delay weaning. We have that for 2 researchers. Or the pups are smaller than 10 grams, or medical needs necessitates a delayed weaning, and that's going to be per veterinary approval. If the weaning is being delayed, be sure that you record a new projected date as well as the weights of the weanlings on the wean on sticker. This is our documentation and proof to outsiders that we have indeed assessed the animals. Weaning, sex determination. You need to wean your mice into cages according to their sex. We determine that based on their anogenital distance. The anogenital distance is further in males than in females, but it can be confusing if the females were surrounded by males in utero. Females often also have nipples where males don't. If you are in doubt, request a sex recheck by a more experienced team member by placing a recheck sex sticker onto the cage. They are located in each animal room. Here's a photo example for sex determination. Here you can see the anus, you can see the prepuce. It's a very large distance between the two. This is a male. Here's the anus. Here's the other genitalia, very, very close. This is a female. But let me also show you this in video format. If the animal's anogenital region looks the same, keep trying with other animals in that litter until you get one that looks different. Again, the mouse with the longer anogenital distance is going to be the male. It's really helpful to keep one pup of a known sex and use that to compare against the rest of the pups in the litter. When you are setting up your weaning cages, you're going to be using color-coded cage cards. We use the pink cards for females and the blue cards for males. Please be sure to fill in all blanks such as the investigator, the IACUC, where they were weaned from, their strain, their date of birth, their date of weaning, and then how many animals are in that cage. Cage observations. The interior of the cage must be examined daily. The following should be assessed: feed levels, water levels, bedding conditions, and any situations of overcrowding. Feed levels. Adult mice eat 3 to 6 grams of food per day. Each pellet weighs an average of 6 grams. Our feed hoppers can hold approximately 325 grams, which is enough food for 5 adult animals for 10 days. As a general rule, we add food weekly, such that the hopper is returned to the full 325 gram status. However, lower cage populations call for less frequent food replenishment. Here are some visual examples of a full hopper, a hopper that is half full, and a hopper where the food is too low. The hopper with the food too low, that amount could possibly be acceptable if the cage was only holding 1 to 2 animals and was being changed within the next day. We will typically mark a cage like this with a check mark that says check food if it's going to be 48 hours before that cage is changed. The hopper that is half full, cage populations need to be considered when you're assessing their food amounts. That hopper half full, if that cage is of 5 animals and they still have 5 days before their cage change, they're very likely going to run out before the cage change occurs. Water levels. The average adult mouse drinks 4 to 7 mils per day. Our water bottles hold 300 mils, which is enough water for 5 adult mice for 8 days. As a general rule, water bottles are to be replaced with clean bottles on a weekly basis. Again, here are 3 examples of water bottles, one being full, one being half full, needing to be replaced soon potentially, and one that is critically low. The critically low, the water is down to what we call the shoulders of the water bottle. If this cage held a single animal and the cage was being changed the next day, this amount would likely suffice, but otherwise this bottle would need to be replaced. Bedding conditions. And I apologize for not providing a picture of this. Cages are to be evaluated daily for excessive soiling and for water bottle flooding. If a mouse cage is not on a ventilated rack, that cage needs to be changed twice per week. We change the wire tops monthly. We are now approved to change our filter tops as needed. Populations of less than 4 are generally changed every other week. There are exceptions, and those exceptions include our breeding animals if they are pregnant or nursing, our ICR strain, some cages with males, and animals that urinate excessively. This could be project or strain related. Singly housed animals. Singly housed animals must have a hut or a tunnel. Look for those missing materials during cage change. Destroyed huts, however, are okay and they don't need to be replaced. If the animals have chosen to destroy their hut, they can go without that hut for a few more days. Cloudy cages. Amines build up during our autoclaving, and that causes film to develop on the outside of the cages. If the film is preventing visibility of the animals, it needs to be manually removed. You'll need to use a scrubbing pad that's provided in the room to buff the cage. Generally speaking, we do this to the front and one side of the cage. Delayed cage changes. Postpartum cages may be flagged for a cage change delay. When you are in performing your daily checks, ensure that those cages are changed as indicated if it is the day for that cage change to be conducted. Overcrowded cages. There are tables in each room that indicate our housing allowances. If a cage is found to be overcrowded, you'll place a white correction request card on the cage. If the researcher doesn't correct the overcrowding by the date indicated, it will then become SLA responsibility. Here is the visual of that housing requirement placard. In general, we try to keep our adult populations to 5 or fewer in our cages. There are some situations where we have to have fewer animals than that. Room observations. Every day, there are specific tasks involving the room that need to be identified and recorded. You need to check and record the temperature. The animal room temperatures must be within a range of 68 to 79 degrees Fahrenheit for rodents. Our normal temperature window is 72 to 74 degrees. Any rooms with temperatures outside of that allowed range must be reported to the SLA manager. Check and record humidity. Rooms lower than 20% must be reported to the SLA manager. Check the ventilation of the room. If the room feels stuffy or drafty, report it to the SLA manager. Check and record rack ventilation, and this is conducted through the MagnaHelix gauges. If there is deviation from previous days, please report that information to the manager. Again, things to report to the lab manager: rooms that are outside of the temperature range, rooms that have low humidity, rooms that feel stuffy or drafty, and or rooms with rack MagnaHelix that don't align with rooms with rack MagnaHelix gauges not aligning with previous recordings. The census. See SOP SLA 015 for additional details. Your responsibility is to count each cage for each IACUC. Refer to the room clipboards for the specifics. You will record that count on the appropriate section of the census sheet. Make yourself notes for updating any changes in Prime. If you don't have Prime access, make sure that you are providing that room's census information to a SLA member for input. We count all adult rodents individually and record that number in Prime every Wednesday. Stocking room supplies. Generally speaking, supplies are restocked on cage change day. You need to ensure that there's enough for the following day of cages, filter tops, wire bar lids, cage cards, cage card holders, and water bottles. If you use the last of something, you are responsible for replacing it. Stocking PPE. You should be checking your carts and restocking as needed. This includes yellow gowns, gloves of all sizes, white shoe covers, bouffants, and face masks. Any PPE for the expanded SPF rooms 0132 and 0130 must come from an unopened box in the exercise room and not the janitorial closet. Odds and ends, things that we look for every day in every room. Expired items, chemicals near food, chemicals near drinking bottles, missing MSDS labels, missing pink tags on heating pads, overly full Sharps containers, MB10 bottles missing the Made On sticker, MB10 bottles missing the Made On date, and MB10 with a Made On date that is older than 7 days. Task sheets. Please be sure to sign off task sheets for each room. Make sure that you complete all fields. If something was determined to be within normal limits, add a check mark. If you performed an action, put your initials in the corresponding box. At the end of the day, be sure that the following has occurred. Rooms were checked according to the schedule. Double check that rooms weren't added to the schedule after the day has started. Treatments were given, soak chow was provided, pup numbers, births, and strains were documented on breeder cards and in the birth log. Census numbers were documented on the clipboards as well as in Prime. Task sheets were signed, and generally speaking, the facility looks tidy. We are always supposed to be inspection ready. Please report any concerns or problems to the Small Lab Animal Unit Manager, lead technician, or unit veterinarian. If you have any questions, please reach out to the unit manager. Thank you so much for taking the time to complete this training.